Zypitamag, also known as pitavastatin, is used alongside a healthy diet to lower bad cholesterol and fats, such as LDL and triglycerides, while also increasing good cholesterol, HDL, in the blood. It belongs to a group of drugs called statins, and it works by reducing the amount of cholesterol produced by the liver. By lowering bad cholesterol and triglycerides and raising good cholesterol, Zypitamag can decrease the risk of heart disease and help prevent strokes and heart attacks. In addition to maintaining a proper diet, other lifestyle changes that can help Zypitamag work more effectively include exercise, weight loss if overweight, and quitting smoking. It's important to consult your doctor for more details, including the optimal dosage and the best timing for taking this medication. The best way to take Zypitamag is by mouth, and you can take it with or without food, as directed by your doctor. Usually, you only need to take it once a day. The dosage of Zypitamag depends on your medical condition, how you respond to the treatment, and any other medications you may be taking. Make sure to let your doctor and pharmacist know about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are also taking other drugs to lower your cholesterol, such as bile acid-binding resins like cholestyramine or cholestyramine, make sure to take Zypitamag at least 1 hour before or 4 hours after taking these medications. This will prevent them from interfering with the absorption of Zypitamag. To get the most benefit from Zypitamag, take it regularly and at the same time every day. Even if you start feeling better, keep taking it as prescribed. Most people with high cholesterol or triglycerides don't feel sick, so it's important to keep taking Zypitamag as directed. It's crucial to follow your doctor's advice about diet and exercise while taking Zypitamag. It may take up to 4 weeks before you start to see the full benefits of this medication. This medication has been prescribed because your doctor has determined that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. A very small number of people taking pitavastatin may have mild memory problems or confusion. If these rare effects occur, talk to your doctor. Rarely, statins may cause or worsen diabetes. Talk to your doctor about the benefits and risks. This drug may rarely cause muscle problems, which can rarely lead to very serious conditions called rhabdomyolysis and autoimmune myopathy. Tell your doctor right away if you develop any of these symptoms during treatment and if these symptoms last after your doctor stops this drug: muscle pain, tenderness, weakness, especially with fever or unusual tiredness, signs of kidney problems such as change in the amount of urine. This medication may rarely cause liver problems. Tell your doctor right away if you develop symptoms of liver problems, including nausea, vomiting that doesn't stop, stomach or abdominal pain, yellowing eyes or skin, dark urine. A very serious allergic reaction to this drug is rare. However, get medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching or swelling, especially of the face, tongue, throat, severe dizziness, trouble breathing. This is not a complete list of possible side effects. If you notice other effects not listed above, contact your doctor or pharmacist. If you are in the US, call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. If you are in Canada, call your doctor for medical advice about side effects. You may report side effects to Health Canada at 1-866-234-2345. Before taking Zypitamag, make sure to inform your doctor or pharmacist about any allergies you may have, as this medication may contain inactive ingredients that could cause allergic reactions. It's important to also discuss your medical history, especially if you have liver or kidney disease, or if you consume alcohol. If you are planning to undergo surgery, be sure to inform your doctor or dentist about all the medications and herbal products you are using. It's recommended to limit alcoholic beverages while taking Zypitamag, as daily alcohol consumption can increase the risk of liver problems when combined with this medication. This is especially important for older adults, as they may be more sensitive to the side effects of the drug, particularly muscle problems. If you are pregnant, Zypitamag should only be used if clearly needed, as it may harm an unborn baby. It is also unknown if this medication passes into breast milk, so it's best to consult your doctor before breastfeeding while using Zypitamag. It's important to be aware of potential drug interactions with Zypitamag. This includes medications like colchicine, daptomycin, and gemfibrozil, as well as other drugs that can affect the removal of pitavastatin from your body, such as cyclosporin, letermovir, and sofosbuvir/velpatasvir/voxiloprevir. Additionally, it's crucial to avoid taking any red yeast rice products while using Zypitamag, as they may also contain a statin called levastatin. Combining pitavastatin with red yeast rice products can increase the risk of serious muscle and liver problems. Remember to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. And as always, do not start, stop, or change the dosage of any medicines without your doctor's approval. If someone has taken too much Zypitamag and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. It's important to not share Zypitamag with others. While taking this medication, it's essential to undergo regular lab and/or medical tests to monitor blood cholesterol/triglyceride levels and liver function. Make sure to keep all medical and lab appointments and consult your doctor for more details. If you forget to take a dose of Zypitamag, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one. Take your next dose at the usual time. Don't take an extra dose to make up for the missed one. It's important to store Zypitamag at room temperature, away from light and moisture. Avoid storing it in the bathroom and keep it out of reach of children and pets. When it comes to getting rid of Zypitamag, make sure you don't flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the medication when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.